So next procedure we're going to do is a cervical nerve root injection. This is essentially a simple, minimally invasive pain management procedure for administering some cortisone, steroid preparation around one of the nerve roots. And the nerve roots is the big collection of nerves which comes out of the spine. This is cervical nerve root, so this is coming out of the cervical spine or the neck. And the patient in question has pain essentially in the thumb and index finger. The procedure is done under X-ray guidance, so we'll be looking all the time under the X-ray, carefully putting a needle down to where that particular nerve root is. We will locate it, and then we will put some dilute local anaesthetic and a steroid preparation around it to try and stabilise the nerve and reduce any inflammation. Yeah. Yeah. That's fine. Okay, so we've got that into the right place. Just put a teeny bit of dye in there. Make sure that we're in the infiltrate a little bit around there. Okay, come out with the X-ray now, please. Now, what we're going to do now is make up some Botox. Botox is the same substance that's used in cosmetic practice, but we actually use it extensively in pain medicine. It's very useful for allowing relaxation of muscles, and it's also used for neuropathic or nerve pain. And there's certain conditions, for example, trigeminal neuralgia and other locally painful nerve pains that it can actually be quite effective for. So to make up the Botox, first of all, I'm just going to take some long-acting local anaesthetic. This is bupivacaine, 0.25%. Here we have a vial of Botox. This is 100 units of Botox that we use. The maximum we use in one sitting is usually 200. Just put that over there, please. So just hold it for me. That's it. So first of all, we just administer some in. Now, we never shake Botox. We always swirl it, basically. And the reason is the Botox has protein material in it. If you shake it violently, you can denature the protein and basically it renders it useless. Okay, so if you just put that there. Now what we're going to do is just put a little sterile needle. That the bung is all sterile. That's to take the air out of it. And then we're just going to put that in. Let go, please. Put that on the side, and if you can hold that, please. Just hold that nice and still. So now we're just going to aspirate and take back that local anaesthetic mixed with the Botox. Thank you. As you can see, it's entirely colourless, the Botox. You can't see anything in there, there's just some air bubbles in there. And a fresh orange needle, please. For this particular procedure, I'm going to just increase the volume there. And there's some muscles that we're going to be injecting into. There's lots of ways of injecting the Botox. A lot of the time we use something called a nerve stimulator, which helps us to locate local muscle. But in this particular case, we're just going into the muscle because we know these trigger points very well. So in this patient, a lot of the muscle spasm that he gets is on the left-hand side. These little holes here are where we've just injected the facet joints. This one is where we've done a cervical epidural. But most of his pain, spasm-wise, is in this distribution, and in particular in the trapezius muscle. That's the sort of triangular-shaped muscle at the top of the neck that's attached to the neck and sort of fans out at the top of the thorax. Orange, please. Orange, so we just lift up the muscle. We have that between our fingers, and we just administer about 1 ml, and that's going to contain about 7 or 8 units of Botox in each one, in each injection. Have to be careful in this area because the lung does run close by and there are quite a lot of other blood vessels, so we just have to make sure that we've got hold of the muscle before we inject it. As I said, sometimes we use a nerve stimulator in order to locate it, and that's particularly useful when you have thin patients or patients with little muscle bulk. In this gentleman, we can feel the muscle quite easily, and that's injecting nicely. You can certainly feel the needle tip grip when you're in the right place of the muscle. Okay, done. Thanks, guys.